Welcome back to In Focus. Now, when you purchase your medicine, are you confident that it's real? Well, counterfeit drugs are quite common in some areas, but now there's a way to check the authenticity with your mobile phone. It's called M-Pedigree, and our Lenore Madu has the story in today's edition of the Africa Health Network.
Bright Simons is trying to curb the rampant trade of counterfeit prescription and over-the-counter drugs. The Ghanaian innovator is using a free text messaging service known as M-Pedigree. It helps consumers verify the authenticity of the drugs they are buying against a central database. Drugs protected through M-Pedigree carry a short code that is revealed through scratching an area of the packaging. Users send this unique ID via free short message service, SMS, and immediately get a message to verify the drug's authenticity.
SMS, it goes to a hotline. It's a 4-digit number, so it's easy to memorize, 1393. It's just like a 911 or a 999. You get a response in a few seconds confirming that the medicine that you're about to receive is the genuine medicine. Classified by the World Health Organization as spurious, falsely labeled, falsified counterfeit medicines, or SFFC, the fake products range from random mixtures of harmful toxic substances to inactive, ineffective preparations. Some contain a declared active ingredient and look very similar to the genuine product, deceiving health professionals as well as patients. WHO says SFFC medicines can result in treatment failure or even death. Statistics show that every year, 700,000 people die globally of causes related to counterfeit medicines. M-Pedigree user Redeemer Hatsu says the technique is empowering.
With this new system of authenticating the safety and originality of drugs, you're sure what you're buying, so we don't have reported cases of people suffering because they took in counterfeit drugs. So I'm sure what I'm buying, having text, I know I'm safe with this drug.
Observers say malaria drugs are one of the drugs that are often counterfeited. In a recent study conducted by global health scientists, around 36% of anti-malarial drugs analyzed in Southeast Asia were fake. A third of samples in sub-Saharan Africa failed chemical testing because they contained either too much or not enough active ingredient. Dr. Alex Dodo heads the Center for Tropical Clinical Pharmacology and Therapeutics at the University of Ghana Medical School. He says the issue of counterfeit drug in Africa is critical.
The challenge is knowing the size of the problem. We know there is a problem. When studies have been conducted, you can get up to 40% of all medicines for malaria being not of the expected standard or being counterfeited or being fake. For some conditions or some anti-malarials or antibiotics, the problem is worse. So one of our biggest challenges is to actually quantify the size of the problem and then begin to deal with it. But there is a problem. The problem is not getting better. It's getting worse.
The source of a SFFC medicine is often unknown. In addition to health risks, fake medicines cause an important loss of revenue for the pharmaceutical industry. M-Pedigree is partnering with key stakeholders in the industry, including drug companies and drug regulatory agencies, to try and spread the impact of the authentication system and reach more people.
The biggest challenge is how we align with the government's existing mandate to make this service more widely available. The next job is then to get pharmaceutical companies to undertake those processes that they need to undertake for the platform to integrate with their manufacturing systems. They have to undertake a number of exercises for the integration of the service into their manufacturing system.
Simons has received support from the World Economic Forum and TED, a global forum for innovative ideas. He received several awards for this work against the counterfeit drugs trade. Lenore Madu, VOA Africa Health Network.
Well, the first Dreamliner has come to Africa. Ethiopian Airlines has added Boeing's 787 to its fleet, making Ethiopia the only country aside from Japan to operate the innovative aircraft. VOA's Roseanne Skirbel has a closer look at the Dreamliner.
From the outside, it may look like a normal passenger jet, but sneak inside and you will know the full extent of its innovative features. The company claims that it's a leap forward in aircraft technology, and it's won this year's prestigious Collier Trophy for this achievement. Started in 1911, each year the Collier Trophy is given to the company that introduces innovative technology in its aircrafts.
And the Collier Trophy is the oldest aviation award probably in the world, certainly in the United States. And they won the Collier Trophy, to your question. They won the Collier Trophy for really building a plane that really pushes the whole technology of aerospace forward. They've done things on this plane that really have never been done before, and they've done a number of them at the same time.
Boeing has used new technology to enhance passenger comforts. The plane has large seats and more leg space. The passengers breathe fresh air as the air filters installed in its body keep impurities out. The cabin pressure is maintained in such a manner that passengers feel fresh even after a long flight. The lights are adjustable according to what passengers want. The windows are large and unique.
We no longer have a window shade, so with 5 clicks of the button, you can go to a tinted window to a completely opaque window, but you'll still see outside, even at its darkest. Or 5 clicks and it'll transition back into the light window.
The Dreamliner is cost-effective and environmentally friendly. Instead of metal, it's made of composite material, which makes it lighter than traditional aircrafts. The wings are designed to reduce air resistance. The engines are quieter and emit fewer harmful gases, causing less damage to the environment. The Dreamliner also consumes less fuel and can travel longer distances. But all these innovations have come at a price. According to media reports, the development of this plane has suffered significant delays. And in spite of having many orders from airlines around the world, the rate of delivery has been very slow. The company claims it's overcome these difficulties, and Dreamliner is now set to give its passengers an experience of a dream flight.
That was Roseanne Skrober reporting, and Ethiopia's Dreamliner is called Africa One. It will fly throughout Africa and Europe. And that's our show for today. Please be sure to watch In Focus on our website at voaafrica.com. For more news, tune into VOA's evening radio show, Africa News Tonight, at 1600 and 1800 UTC, and in the mornings to Daybreak Africa beginning at 0300 UTC. That's Monday through Friday. As always, we thank you so much for watching. Good night, and join us again tomorrow.
Discover the smiling coast of Africa.
Kacha filin da program murnan television auto. Me mo nyin kaka wala
program o jubel bakar fati.